Hello. So your doctor wants you to do an ultrasound. And in this video, I'm just gonna give you a little bit heads up what to expect and how to get ready, because a lot of time patient comes in and they think they're gonna be in and out for 2 minutes and they don't have to take any clothes, and they're surprised when they learn how the exam gonna be look like. Now, first of all, let's put the stop of the rumors that we're looking at the babies all day. Okay, we don't. Ultrasound is more than looking at the babies, which is we do look at the babies, but we also look at everything that pretty much soft tissue. We look at the thyroid, we look at any lumps and knots on the neck, on the head, anywhere on the body. We do pelvic and transvaginal exams, we do scrotum exams, we do abdominal exams, we do renal exams, we do a lot of vascular studies, and obstetrics is probably 10% of general ultrasound technologies. Now, if you go to clinic for the perinatal patients, then yes, they look at the babies all day. You're right. Now let me tell you a little bit more about the ultrasound. Ultrasound use no radiation. You use sound waves from something that's called transducer, kind of like this. It could be different shape, different brands, and it applies on your skin in an area of interest. And in order for the ultrasound to receive any image, you have to be covered with gel. It's kind of like this. Okay? This gel usually made mostly of water, but it's still a goo. Sometimes it can be cold, sometimes the people have warmers and the gel is warm. Has nothing to do personally with the patient, okay? It all depends on equipment. If you have a warmer, you're gonna get a warm gel. If you don't have a warmer, or it's not working, you're gonna get the room temperature gel. But it doesn't work without gel. You can't get images without gel. So take this out of the way. I don't know, I know in the other countries, the physician, the actual doctors, do ultrasound and they will follow up with diagnosis. That's not the case in the United States of America. In the United States of America, ultrasound technician or sonographer does not give you diagnosis. Don't ask them. Diagnostic sonographer performing ultrasound on you will not be able to give you good or bad news or confirm or deny anything. Because in the United States of America, they are not doctors. So with that being said, they can't do anything about giving you any information about diagnosis. They are there to provide good quality images for your doctor to look at after the radiologist look at those images first, and then they will give you results. Not during the ultrasound session with the sonographer. Is ultrasound different from the other modalities like X-ray, MRI, CT scan? Yes. Ultrasound is more personal and take more time, but it has no radiation. So the benefits: you don't have to worry about having some earrings or taking off your, every piece of metal from you. You don't have to worry about the radiation during that exam. But it also comes with, you're going to be covered with gel in the area of interest, and you'll stay there much longer than getting X-ray image, okay? Some exams take up to an hour and a half. Some exams can be done in 15 minutes, 10 minutes. But usually 30 minutes to an hour. So let's say you watch me talking through the beginning of this video, you're still watching, and here is the questions that I hear from the patient. Do I have to take the clothes off? Yes, in the area of interest. So be mindful if you get an abdominal ultrasound. You will have to, you know what, let me show you better. During abdominal ultrasound, you have to lift up your shirt like this, kind of lower your pen. We're going to give you some towel or paper towels, and we're going to look at this area. We're going to turn you on the side, look through this area, and then we're going to turn you on this side. If doctor ordered a complete exam, we're going to look at this area. Okay? We can see from different angles, different organs. With that being said, if you feel your pain somewhere that we are not looking, you can point it out, but doesn't mean we're going to miss it, because we might just approach it from the different angle. Abdominal ultrasound is about 30 minutes exam. Okay, could be longer, could be shorter. It depends on many things. And that doesn't mean something wrong with you if it's longer. It just means you're harder to see. So to make it easier for us and faster for you, just follow the instructions, because usually people will tell you you should be fasting. So don't eat, don't drink like coffee, and for about 8 hours at least before you go in for your abdominal ultrasound. So that will make images more diagnostic, and the exam will go faster. Thyroid exam. Thyroid is right in this area, right? So don't wear any nice shirt that you're afraid that gel get on. We will put some towels and stuff around your neck to protect your clothes, but it's probably gonna, the chances are, so be mind that we're gonna need this area exposed. And sometimes we also include the neck, so we'll go all the way up here and all the way up here. Okay, so that's probably it. Yeah, you will have to lay down, and I discourage you from talking too much during exam, because it's affect the images. So we need you just to relax and let us do the job. If you're talking, everything moving, so it's take a little longer to get it done. The carotid exam. If you don't know, the carotid is the arteries that bring the blood up on this side of the neck and up on this side of the neck to your face and to your brains. So if your doctor orders you to do a carotid exam, you will be first kind of turn head one way, not too much. We don't ever want you to strain your neck. Just like a little bit on one side, so we can follow this side, and then you turn this side. We do the opposite side, and you'll hear a lot of noise, because we can also measure the velocity of your flow. And then again, take images, record our report, send it to radiologist, and he send it to your doctor, and you hear from them. Now, if you just there for a soft tissue lump, okay, that does not include like breast lumps, okay, but it's, let's say, something on your neck, or something on the back of your head, or something on the back of your back, or on your arm, on your leg, just a lump under skin, right? So just this area needed to be shown to us. So make sure you can get easy, show it to us, so we can scan, get the images, and get you out of the door, enjoy the rest of your day. Upper extremity. So if your doctor worry about you having a blood clot in your arm, okay, they might order you an ultrasound. With that being said, we start with your neck, okay? Depends on the side. We start with your neck, and then we follow through your shoulder, in your armpit, and then we follow on the side of your arm, and then depends on the protocol. and doctor's order, you might also go follow down to your wrist. Okay, so once again, if your doctor wants to check your veins in your arm, most likely you will have to expose your neck, your shoulder, your armpit, your arm. Okay, so dress considering that. Okay, if we can give you a gown, or we can just cover you with we can, if it depends on the facility, some facility we can just give you a gown and you change, but your neck, all this area with shoulder and armpit, and then you're gonna go to your arm. Okay, so if you say you have a bump right here, why am I looking there? It's a protocol. We have to. It might affect something that started from here, might affect something here. Something that started here might affect something there. It's part of the exam. Okay? So, you're pregnant and you order your ultrasound, right? The first trimester, you come in, it's usually going to have two parts. First part, transabdominal. You're going to lift up the shirt, we're going to put a lot of gel, we're going to take pictures, send to your doctor. The second part, usually on the same day, is transvaginal. It's when we use a different probe, we cover it with sterile cover, and we put you in a position when your legs is on the stirrups and open, but you covered for your privacy with the blanket, and then we put the probe inside and we take pictures from the inside. That's for the first trimester. The second trimester, you lift up the shirt, we put the jelly, take a lot of pictures, send it to your doctor. During the second trimester, it's usually the longest exam because that's where we can check most of the anatomy of the baby. Third trimester exam. It's usually when you need to check for baby anatomy, positioning, or size. Same thing. Lift up the shirt, we put the jelly, we use the transducer, take pictures, send to the doctor. Now, during the second and third trimester, there might be a need for transvaginal exam because sometimes we need to look at the cervix, and baby positioning will just not let us to see it from the top, so we have to look from the inside. So be ready that it might be happening, but not always. And usually for all the pelvic exams, you want to have full bladder. You don't want to have like really full, you're ready to burst, but you want to have plenty of fluid in your bladder because the bladder create acoustic window for us to see better images, and it also create nice jumping surface for your baby. No, that's just a joke. But yeah, usually we will need you to have a full bladder for this type of exam. So you're pregnant, you go to get your ultrasound. Same rule apply. The sonographer in the United States is not a doctor. They're not going to tell you if something wrong or everything is okay. Okay? Just no. They're not doctors. We're not doctors. Okay? We take images and send our report to radiologists, and they will follow up with your doctors. So don't try to read our faces. You're just gonna make yourself more nervous because, let's say, I want to take a picture of baby's nose and lip, and baby gonna be turning away. So my facial expression, trying to catch this image, will be like, and you might be like, oh, what's wrong? See, I can't tell you if something wrong or not wrong. And now I'm in a situation where you just assume something wrong. The pelvic exam. The pelvic exam that not about pregnancy has two parts too. First part, transabdominal. You will lift up the shirt. We recommend you to have a pretty full bladder. So we take pictures from the top. The second part, we use transvaginal probe. We put the sterile cover, put the probe inside, take pictures from the inside. Now, sometimes, depends on the facility, you might get transvaginal done first, and then the sonographer will take more pictures from the top with the different probe, transabdominal probe. So the order might be different, but that's what usually included, because one view give like a big view, like give us a bigger picture, another view give us the more detailed picture, and that is really important for your doctor and for radiologists to provide you best care, so they can have better images. Now, since pelvic exam is really private exam, there most likely will be a female chaperone during exam. With that being said, the sonographer who does your exam can be a male or female, because we all train to do that exam, and we can't just have females or only males doing certain exam, because that will make one person work more than another, and that's just not fair. Let's say if we have 10 patients for the day, and 2 of them thyroid and 8 of them type of first trimester pregnancies and pelvic exams, so, and we have 1 female and male working, and only female going to do all those 8, that's going to make her really, really tired. That's why it's just not fair to not let somebody to do some job because of their gender, okay? With that being said, you can deny any exam if you don't want technician to do it. You can reschedule and see if you can get another person to do it. But the reality is, we all train, we're all there to help you. We're not there to violate your privacy. We're just there to follow up the protocol and get the images for your doctor, okay? Males or females, or anyone who work in medical field, regardless of their gender, okay? So just don't feel like you're forced to do it, but on the other hand, you can't really pick and choose who you're gonna get, because if hospital have the male technician on schedule, you're gonna get the male technician. If the hospital has a female technician on schedule, you're gonna get a female technician. So, of course, you can decline it, cancel it, reschedule it, but they can't guarantee you to get a male or female, because that would be putting more works on certain gender and giving more work to another gender. So just not fair. Yeah, does make sense? I hope it does. Now the scrotum exam. Okay, this one can also make patients feel a little bit awkward and uneasy. So the way you want to get ready for it, I'm going to put some creative demonstration, but with that being said, yes, you have to, take off your underwear and provide for sonographer, male or female, whatever you're gonna get, whoever's on schedule, their area of interest for scanning, so they can get diagnostic medical images for your doctor to help you. Okay? Nothing else. It's professional medical care. That's all it is. Okay, guys, this is my improvisation for you to understand how to get ready for the scrotum exam. So, first of all, you're gonna do it, not sonographer, you're gonna do it. You're going to take off your pants, lay down, and then your penis, you're gonna move it up and out of the way and cover with a towel, like this. So now the technician can take images of your scrotum. Sometimes they'll give you another towels, and you can put them under your scrotum, so you can get better support and you can get better images during this exam. Okay? So they're gonna put a lot of gel and take images from different angles. And that's pretty much it. The next exam is legs, venous or arterial. So if doctor wants us to take a look at your blood flow in your legs, let me show you, let me tell you about this one. That's probably the most confusing for the patient, because when they come in, they just want to show me, oh, like I hurt my thigh or my knee, and we start telling them they need to take off the pants, and they look at us like, what? Why? Let me tell you why. There is a protocol of medical exam that we have to follow. After we follow through the protocol, then of course you can point us with your fingers, like certain area you want us to, where you have pain and concern, and if we haven't covered during the protocol, we'll usually take a look at it as well. But we do have to do what the doctor ordered, okay? And that's including starting really high in the groin area, like right here. Sometimes, some places, they even go higher. They even go higher, and they start almost from umbilical area. Like some places they start from the top, and then they follow down. And that's where your blood vessels go. So it's go this way, and then it bifurcates, and it's go in your legs. So we usually start from here, and we're going down, and we put pressure. Going down, down, down. We look below your knee, behind your knee, and below your knee. Then we do some pressure during this exam. It's a part of exam, okay? And if we do other leg, same thing. We start really up high. So you will have to take your pants off. You keep your underwear on, and we cover you with a blanket or something to keep you warm and keep you more comfortable. So if your doctor order your check your blood vessels in your legs, be ready that we're going to start really high from your groin, or some people, as I mentioned, start almost from umbilical area and follow down to your leg. Now, depends on the exam, you're gonna hear some noises, and sometimes you're gonna feel us putting pressure, and sometimes for certain exams we're gonna make you to in a position when your legs will be lowered. So some places they even do it when you're standing, but then you have to be standing on step stool, and it's right now they just use those the tilt of the table, yeah, for some exams. But it all depends what they order. But the main thing I want you to know, you have to pretty much take off your pants, you keep your underwear on, we're gonna put some towels, some blankets, and we start really up high from the groin, and we go all the way down through your leg. Okay. What else out there? There's also abdominal aorta screening and surveillance, which is pretty much as you get ready as for the abdomen. It's better if you're fasting, and you're going to lift up your shirt and you're going to look through your abdomen all the way to your belly button. So that's the area that you need to show us. As well, another common exam is renal. For the renal exam, you usually need to have full bladder. And if your bladder is really, really full, let the sonographer know. So they start with the bladder. And because we need pictures of your full bladder and empty bladder, okay? So as soon as we get pictures of the full bladder, you can go to the restroom and come back, and we take pictures of empty bladder, and then we move on to the kidney. If your bladder is not full, we start with the kidney. We look at your kidney right, kidney left, and then we look at your bladder when it's hopefully full by that time. If it's not, we take pictures and show them that it's not. But you'll have to be hydrated, lift up the shirt. We're going to look on your right side, left side, or whatever your kidneys is. Don't be surprised. People ask me a question. I thought kidneys on the back. Well, depends how we angle our transducer. We can see your kidney from the back, from the side, and from the front. We just need to angle it from different directions. So don't be surprised if we'll be looking at your kidney from the side, not from the back. Okay, you don't need to, don't go and lay down facing the pillow, okay? Just lay down on the back, relax before the exam. might ask you to turn one way or another way, okay? You don't need to go face down. Well, maybe in some cases you do, but usually no need for that. And then we take pictures of the bladder. And that's it. Well, thank you for watching. There is so much more about ultrasound. This is like huge field in medicine and healthcare, and there is so many different exams. I just try to cover the most common ones that people get encountered with, which is thyroid, carotid, abdomen, renal, obstetrics, pelvic, scrotum, and vascular arms and legs. This is the most common that I see. Now, I'm not trying to teach here about ultrasound because I'm not a professor of sonography, okay? The whole purpose is for the patients who never face ultrasound in their life, or they just think that why do I need ultrasounds? They're just looking on babies all days, and why am I getting ultrasound when my arm hurt, So the whole purpose of this video is to people who are a little bit confused before they go to get their ultrasound done, so they know what to expect and how to get ready. That's the whole purpose. If you're bored from listening to me talking, you can stop this video, okay? I'm just talking right now. Patient comes in to me and Dr. ordering pelvic examine them. And as soon as I tell them that it's going to be a transvaginal exam, they look surprised at me. They said they didn't know that's going to be part of exam. And patient comes in to get the leg vessels checked, to check the veins in the legs. And they surprised, why am I putting pressure on them? And why did I have to take the pants off? And well, because that's a protocol. That's where we start looking from. We start from the beginning of the vessel and we're following it. So I hope that you watch it and you know what to expect when you go to get your exam done. Every place is different, okay? Different protocol, different policies, but I try to be as in general as possible. So don't take my word from this video as a law for all ultrasound scanning facilities. Okay, everybody does things differently. I just tried to make the general video. Okay, now for people who work in the field, and if you want to add anything, you're welcome. Just be respectful and professional and put it in the comments. If you want me to make some other videos, or if you have any other questions about the ultrasound, let me know. I'll make more videos. If you're still watching me talking, thank you for your time. And I hope if you're patient that you will feel better. If you are sonographer, that you are doing a great job. Thank you.